much. Next speaker is Ed Quadros. Thank you. Something about spinal bifida.
I'm used to walking around while talking, and let's get back to the microphone. Thank you all for staying here to listen to the last few speakers. Today's talk is folate receptor autoimmune disorder can affect brain development and function to produce the autism phenotype. In order to understand this, I have to explain to you what is a folate receptor autoimmune disorder. I don't think many of you in the audience have ever heard of this condition. It's a very condition not so rare now that we know about it, and how this connects to developmental deficits and autism spectrum disorder. To explain this, I got to take you back a few years when a lot of clinical trials were done to try and figure out what is the optimum dose of folic acid to be given during pregnancy. And we already knew that going back to the 1930s that folic acid was very important for normal pregnancy development, but they were trying to figure out the optimum dose. And the clinical trials used a dose anywhere from 200 micrograms to 1 milligram to try and figure out what is the best dose for women during pregnancy. There was another objective to this study, and that is to try and see if you can prevent neural tube defects by providing a larger dose of folic acid. Unfortunately, that aspect of the study failed. And the reason for that is, typically when a woman goes to a doctor's office, she's already 3 weeks or more pregnant. Unfortunately, the neural tube closes on day 21. So they already have the problem. The defect is already there, and prenatal folic acid given after that cannot correct it. So it is about this time we were looking at folate deficiency in a rat model in the lab, and dietary folate deficiency was the normal way to look at it, but since we knew that folate receptor alpha is the primary transporter of folate from the mother to the fetus across the placenta, we wondered if an antibody could do the same as a dietary folate deficiency. So we made an antibody to the rat folate receptor and gave it to the gestation day 8 pregnant rats. And these animals then either had complete resorption of embryos at higher doses or developed brain malformation at lower doses. So clearly there was a connection now between the folate receptor autoantibody and brain development that we see in the fetus. It is following this that we hypothesized that perhaps women who have a neural tube defect pregnancy may have an autoantibody to the folate receptor, because women who have a history of neural tube defect pregnancy are not folate deficient by any criteria. They have normal folate status. So, and then why would they still develop this neural tube defect? So that we said there may be another mechanism. How about an autoantibody to the folate receptor alpha? So we did the preliminary study here at Downstate with the help of Joan Krakow. We recruited patients who had a history of neural tube defects, and we then published those findings. How do I go to the next slide? This was the study that was published in the New England Journal of Medicine in 2004, showing that 70% of the women who had a history of neural tube defect were positive for the folate receptor antibody. Oh, okay. Touchpad is better. And the specificity was shown by pre-incubating the patient's serum with folate receptor alpha antigen. So clearly there was a correlation between the presence of autoantibody and neural tube defect pregnancy. Following this, we looked at another condition known as cerebral folate deficiency syndrome. This is a disorder that occurs in young children around the age of 6 months, and it's progressive, it continues, and by the time it's 3 to 4 or 5 years, these kids present with low-functioning autism. You can't separate them from low-functioning autism, and if it continues, they even get worse. So our collaborator, Vincent Raymaker, had been studying these children for a long time, and so when he saw our identification of autoantibodies in neural tube defect pregnancy, he wondered if a similar mechanism could exist in these kids, because one observation that he had made was that all of these kids had low CSF folate, extremely low. That leads to cerebral folate deficiency. And so he's been treating them with high-dose folinic acid, and they've been showing improvement, but he didn't know the mechanism by which this is occurring. So when we analyzed the samples from these patients, 84% of these kids had the autoantibody to the folate receptor. They all had low CSF folate. And there was a clear correlation between the antibody titer and decrease in CSF folate. So there's a nice connection established here. Now, why does folate play such an important role in brain development function? If you look at the development of the brain, whether it's the embryonic stage, fetal stage, or subsequently, you can see that folate contributes to a variety of metabolic processes, including one-carbon exchange reactions, amino acid synthesis, neurotransmitter synthesis, as well as purine pyrimidine synthesis for DNA replication that controls cellular replication, and then, of course, epigenetic mechanisms by methylation processes, as well as neurotransmitters. And homocysteine elevation is an effect of folate deficiency. That causes homocysteinylation of proteins in the brain, and that causes a dysfunction. So all of these factors contribute to neurodevelopmental deficit or neurologic deficits in the brain attributed to a single vitamin. So following this, we looked at autism spectrum disorder. This was done in collaboration with Richard Fry, who was then at the Phoenix Children's Hospital. What we did here was we looked at a whole bunch of kids in the autism spectrum disorder and found out that over 70% of these kids were positive for the antibody. Treating with high-dose folinic acid improved language, expressive language, verbal communication. These are all core symptoms of ASD. So here is an example where the first time we could actually see changes in the core symptoms of ASD. So now that has led to 3 ongoing clinical trials. I will skip that slide. And currently we have ongoing clinical trials at Phoenix, Emory, Harvard, now here at Downstate, funded by 3 different agencies. These are ongoing trials. Hopefully we will complete these in 2023. So if you have anybody you know of who has autism spectrum disorder, Harris Huberman here is the PI on the clinical trial. We will encourage you to bring those kids for evaluation and treatment. Thank you.